Is the popular posterior pelvic tilt exercise actually doing more harm than good? If you're using it to stretch your low back or strengthen your core, it might feel helpful at first, but here's the problem. This one movement can actually flatten the natural curve in your lower spine, and over time, that can lead to bigger issues. Let's unpack why that happens and what to do instead if you still want to train that movement. So first, let's clear up what these pelvic tilts are, especially a posterior pelvic tilt. So a neutral spine position, you should have a nice curve in your low back. But with a posterior pelvic tilt, it's like you're tucking your tailbone under, you're tipping your pelvis back. That's why it's a posterior pelvic tilt. These are common and popular with core workouts, Pilates, and even, doing these exercises to try to help with low back pain. By itself, it can be damaging, but it can be part of a overall routine of the pelvis, of the low back, to make sure you're getting all the motions there, not just that one, because just doing that can be damaging, especially because most of our days are spent in a flattened low back posture anyway, in this posterior pelvic tilt posture, which puts a lot of strain on the low back. So here is, just for comparison, an anterior pelvic tilt. It's where you're tipping your hips down or tipping your hips forward. And what that does, it induces a deeper curve of the low back. Now, these are all good movements to train, but we don't want to lose the normal, natural S shape of the entire spine and then this C shape down in the low back, because that protects your nerves, protects the spinal cord, protects the amount of pressure on the discs, on the bones, on the ligaments, so they're not wearing down. So that's the first thing, is just to understand what a posterior pelvic tilt is. And this is done in different positions. This is done, again, obviously in standing, which you see here. It's done in, sitting, lying down on your back, on all fours, which I'll show you in a second. But this is, again, a good movement, but not one to train excessively. Here's an example just showing, again, what a normal spine should look like from neck, mid-back to low back. This nice S curve, a curve in the neck, one that counteracts it or goes in the opposite direction in the mid-back, and then another in the low back. So you see, when you do this type of posterior pelvic tilt exercise too much and you train it too much, now it's going to flatten the low back, and you're going to see in a second why that can lead to bigger issues and what issues that can lead to. So that tips the pelvis, back, takes the tailbone forward, the like pubic symphysis up. That's the motion, or that's the direction, or the feeling that you get, and then that flattens the low back and even takes it too far back. And then here, this, again, for your body to counteract these types of movements, or the position that your body and spine is in, to balance it with gravity, well, now the upper part many times goes forward. So we don't want to lose that. We don't want to lose the normal curves of the low back. Why? Because the low back curve is related to how it feels, is related to pain. So here again, a normal low back curve on an x-ray, looking at it from the side. And then this is a phase 1 degeneration, which means you lose the normal curve. Now, it can be excessive, but typically what we see is a flattening of the low back. And what happens is it predisposes you to low back pain, whether that's from herniated and bulging discs, from accelerated wear and tear or breakdown of the cartilage, which is arthritis or disc degeneration. And this is proven in this study here, looking at 13 different studies, actually, and hundreds of healthy patients and hundreds of low back pain patients. And that's what they found, a strong relationship between losing the curve, a flattening of the low back curve, and low back pain, whether that's, again, from disc problems, whether it's herniated disc, degenerated disc, arthritis. So this is why this is so important, to make sure we don't just train a posterior pelvic tilt, but we want to train the entire motion of the spine. So one of the best exercises for this is the cat-cow exercise or the cow-cat. So basically you're on all fours, sinking your belly towards the floor as you're sinking your belly, you're arching your back and pushing up with your arms and looking up. And then you hold that for a couple seconds, a beat, not too long. And then you go in the opposite direction. So you see, I'm still training this motion, but it's not just that movement. It's not just flattening the low back. This is a good spinal hygiene type exercise, just like we take care of our teeth every day, or we should. Same thing with the spine. We want to take it through its ranges of motion to help to lubricate the joints. So if it's too hard for you to get on all fours, this might even be a better one, which I like, is sitting in a chair. So you sit at the edge of a chair, hold onto your knees with your hands, and as you arch up, okay, it's basically what a seated cat-cow exercise. So you're taking your belly forward, you're arching your low back while you're pulling on the knees. And then as you go down into the cat, so you see that, arching forward, pulling on the legs, holding for a beat, and then going down. Now you can also do this, modify it to where if you don't want to take your head and neck all the way down, just keep your head and neck looking forward, and you're just using this part of the spine, and we'll get to that here in a second, where you are just looking straight ahead. You're not tipping the head down. Here, you're just arching it forward, pulling into your knees, and then slumping down just in that part of the spine. So you're not rounding the entire spine. So give that a go. Doing that every day, maybe a couple of times a day, 10 reps per set. I would say a good rule of thumb, doing this type of exercise 3 times a day, doing 10 reps. Okay, so 10 reps in each of those directions. And if you want a even more thorough guide on how to exercise and the exercise prescription for living a healthy 100 years, including for your spine, just type in "move" in the comments and I'll make sure I'll get this to you. It shows you what movements to do, gives you sample workout, sample mobility routine that you can modify based on your needs, because this is all about helping you be your own guarantee for your health and your life. All right, see you next time.